Japheths Ogendi. Actually, I'm a lecturer in the School of Art, and I'm also doing a PhD work trying to look at the safety of animals and Nairobi and see if we can also.
I'm impressed by your 6 recommendations of things that could be done. I wonder if you could just quickly summarize.
One of them is we can make better facilities for walking and cycling, and 2, we can have traffic coming in the special areas. The enforcement, I think we need particularly to design our centers for people, not for cars. And we also need to put in place traffic education. We also need to have traffic regulations and enforcement. So this is almost not there. Their signs are low, and the traffic police don't implement that code system in this country. Normally, don't even have a mindset of thinking of motorists as being offenders in traffic system. So people violate traffic regulations with impunity and escapement. And that means the vulnerable users are really being killed in this country, and we need to do something. And you look at the infrastructure, it's not there for them. You look at the speed enforcement, they say 50, but it's not enforced. It's still very high. And you look at the mindset of the people generally, they want to get out of their cars, they want to, and you are in Nairobi here, you have seen that motorists care, pedestrians, when they're crossing, they were crossing. So that in a way also discourages people from walking. Yeah, urban people are not cars. We need to look at residential areas, we need to look at sidewalks for people. People need to have where to walk, because the cars don't dominate. Recently in Nairobi, you heard that they were expanding roads, making them one way, but they are making them for cars, and nobody really thinks about this. Education in this country is unfortunately not much of an emphasis. You can get licenses easily on the basis that they can benefit by bicycling and walking, and that they stand to benefit in their health. Unfortunately, some of the health benefits that come, the bad outcomes of not walking come later on in life. So people normally don't attribute them to bicycle and cycling. So it may be difficult, but I think somehow we can start, because you see people already going to the gym, somehow already cycling. So there's a place to cars. Sometimes they find it difficult. They're used to easy way of walking, driving. But if it is deeply entrenched in their minds that they benefit by walking and cycling, then I think they can change. And again, the system must be, in terms of the physical structure, must be put in place. If you make public transport also affordable, then we reduce people will still walk to the car, and they can cycle. I used not to cycle. I was surprised when somebody from Germany was cycling all the way from Maseno University to Kisumu. I said, why? He can afford a car. But I said, no, because it has been entrenched in the system that you start to benefit. I think we need to change that system. If it can be made safer for them, and you see bicycles are also flexible, people can very easily move them, and they also affordable. One bicycle costs something small, like about 400 shillings, so they can easily use if they're safe. I think the one thing is change our mind, and 2 is to make it safe. We know the benefits, and if it is safe, then people can. This is a poor country where bicycles can walk and use for it, and most of the distance people travel also not long, so they can very easily cycle to a respective place of work and school, and school children can also cycle. I think we do that here. We live in this because we cannot change the car. I think the more we get into the system, and the more pedestrians come in, the more I think they can change, and politicians will respond, because most of the voters actually are non-car users. But it's something I'm so passionate about. We need to change that. We need even to support the scientific studies which are going to think about the people who walk and cycle. A great number of people. But
they're the majority.
The majority. Not because they are the captain walkers. They can't afford it, they must, they get killed, but they keep on walking because they have to. I think their safety is paramount. We must look at that. I do think doing studies, doing cooperation, sensitizing people. Certainly. I think there's a lot that synergy of walk and cycling. We need to do that.
Awesome. Well, thanks so much for your time. That was great.